The members of the Medicaid Task Force team of the Indiana Family and Social Services Administration are Alicia Evans, Lei Gong, Seojung Kim, and myself, Timothy Samuel. The Indiana Family and Social Services Administration is a healthcare and social services funding agency that offers services to over 1.5 million users. Their services include aging services, child care, mental health and addiction, and Medicaid. Effective July 1st, 2015, the Indiana Department of Corrections can submit Medicaid applications on the behalf of incarcerated people. Due to these changes, a Medicaid reentry division was established to submit claims on the behalf of individuals at least 30 days before their release from its jurisdiction. Individuals who have been released from prison to re-enter society are called returning citizens. This fits into the Indiana Department of Corrections' overall agenda to improve care and well-being of individuals post-release as they are reintroduced into society. Therefore, our objective is to understand the health outcomes of returning citizens across various demographic factors. This is important because returning citizens, in comparison to the general population, are more likely to visit the emergency department or be hospitalized. This is concerning because this may be triggered by managed health conditions relating to mental health, drug abuse, chronic health conditions, or non-communicable diseases. If left untreated or unmanaged, these will worsen over time and place greater burden on the individual and the overall health system, eventually driving up healthcare costs and leading to crowding out. Our research methodology entails using univariate statistical methods to identify trends in the use of Medicaid by returning citizens. We do so by isolating from the entire database of Medicaid historical claims the very first use of Medicaid after an individual is released from Indiana's Department of Corrections. Because our focus is to understand the extent to which returning citizens use the emergency department and visit their primary care physician, we tag the use of Medicaid accordingly. Then we use graphical analysis to examine how Medicaid use and health outcomes vary across age, gender, race, and geographical location. Returning citizens do utilize Medicaid upon re-entry into society. And this is quite noticeable during the pandemic, where claims were more than 15 times higher in September 2021 than December 2020. This pattern could also be explained by the reopening of healthcare facilities after the worst of the pandemic. Most adults, about 81% to be precise, make their first medical contact with a healthcare facility in over 90 days after being released from a facility. This pattern remains the same if we focus on just use of Medicaid at the emergency department. These patterns remain the same if we disaggregate the data by gender. Interestingly, the greatest number of claims were made by individuals in the age group 31 to 40, for both males and females. Moving forward, we need to understand how well this disaggregation reflects the general prison population to better inform intervention policies. In terms of geographical location, most claims were made in Marion County. This isn't surprising given that Indianapolis, the capital of Indiana, is in Marion County. Focusing on 2021, when we disaggregate all claims by race and gender, most Medicaid claims were made by Caucasian male and female. This pattern holds true even if the fraction of not available race is allocated to different race. In 2021, the overall top 5 diagnosis for the first use of Medicaid is somewhat consistent with the overall health conditions of returning citizens that we identified in the literature. The individuals were mostly treated for nicotine dependence, opioid dependence, hypertension, and long-term drug therapy. And of course, COVID-related issues given the global pandemic. If we focus on diagnosis when the first use of Medicaid is at the emergency department, the pattern is similar. Finally, given that most of the ailments that afflict returning citizens are best served in a consistent community-based longitudinal manner, rather than episodically in an emergency department setting, We examine if returning citizens are visiting the emergency department or accessing primary care. We do find that less claims are being made at the emergency department. This could be indicative that returning citizens are somewhat managing their medical conditions. Moving forward, we will further explore this. Overall, we found that the top 5 diagnoses for returning citizens was related to drug dependence, COVID-19, and hypertension. Most Medicaid claims were made by Caucasian males and females in the 31 to 40 age group, and they were being made at a primary care physician rather than at the emergency department. Moving forward, we will in the future categorize claims according to acute and non-acute health status. By doing so, we can see if the pattern of use of Medicaid can signal the decline of health status and therefore trigger preventative interventions. To this and other analysis, we will also expand our analysis to all historical claims and not just the first use of Medicaid. Another important extension is to compare the use of Medicaid by returning citizens to the general non-prison population. We also wish to expand our analysis to examine trends in Medicaid use of returning citizens from juvenile facilities. The Medicaid Task Force would love to thank our corporate mentor, Christian Gondig, as well as the data mine staff, Dr. Ward, Ms. Maggie Betts, and Pallavi Patti for their assistance and support. Thank you.